chemical safety. So these chemicals can be, they are categorized into different categories, okay, based on their properties. So they are classified as irritants, asphyxiants, corrosive, carcinogenic, mutagenic, next toxic, oxidizers is compressed gas. I think in chemical no classification as such. Flammable is different again, okay. Okay, fine. Tetrogens, okay, there might be some other classifications, you can just add it on bit later, okay. So these irritants will only give you a feeling of irritation. Asphyxiants will stop your, I mean it creates breathing issues, okay. Corrosive, what it will do, it will just melt parts of your body, okay, as simple as that. Carcinogenic, substances causing cancer. Mutagenic, which can change mutation, I mean it can affect your DNA, okay, and can it can mutate your gene, okay. And toxic, toxic is toxic, harmful, harmful to health. Anything harmful to health is toxic, okay. So these are the classification of chemicals. So in chemicals we are having two type of effects, which is acute effect and chronic effect, okay. Acute effect is the one, okay, acute effect means effect okay effect which is caused by short exposure from a chemical. Not a proper definition, but you can just go through the proper definition, okay. So any adverse effect which is caused by short exposure of a particular chemical. And chronic effect is effect which is shown upon prolonged exposure, right. Prolonged exposure is the long term effect, short term effect is short term exposure. I mean just one inhalation or like within 5 days or 10 days of exposure you will have this acute effects, acute effect and chronic effects. Then we have, see what happens now, what happens if we if there is a chemical exposure, what happens to our body? Main thing is a health concern, we are not considered about some effects on plant or the system or the process, right. So it majorly affects the health of a person, okay. So what happens here is these chemicals will have effect on target organs, okay. What are these target organs? Eyes, okay, your respiratory system, CNS, central nervous system, you have your lungs, lung tissues, you have your liver, kidneys and so on, okay. I do not think chemicals will directly impact heart, but it can impact your skin, okay. Skin is also part of a target organ. So these are the common target organs that we discuss about, okay. So primarily the chemicals which are the toxic, we have discussed about toxic chemicals, right. So the chemicals which impact liver, the chemicals which impact liver are called hepatotoxins, okay. And the chemicals which affect kidneys are kidneys. See, if you got a problem to kidney, which specialist you will get referred to? Kidneys. Nephrotoxins. So nephrotoxins, right? Okay. If the chemicals which are affecting CNS are called neurotoxins, because it will affect your nerves. Okay. Okay. So these are the chemicals. Okay. So how does this chemicals enter into our body? 4 routes of entry. Okay, 4 routes of exposure. Inhalation, injection, ingestion and absorption. Inhalation is through nose, injection is through injections directly we are taking those things. Okay, injection is through food or throat, right, oral. Absorption is skin. Okay, because skin is having pores, and if there is any chemical, what will happen is the spores will absorb that chemical and the toxins will enter into our body, or the chemical will enter into our body. Okay, so how we will know what to be done in case of a chemical exposure, or how do we know about the chemical properties of that particular chemical? Simple. Yeah, refer MSDS material safety data sheet. We have discussed regarding this, right? So I am not going to elaborate much on this. Refer MSDS. Okay. So what are the precautions of chemical exposure? Is first try to eliminate the chemical. If we cannot do, try to substitute it with lesser harmful chemical. Okay, then use, sorry, you can use even what do you say, for some exposures you can use hood, I mean, like, what is this, exhaust, ventilation system. You can have a good ventilation system where it can just suck it out. Okay, LEVs, local exhaust ventilation, you can use. Okay, and apart from that, you have cartridge masks. Normal masks are not recommended. See, in chemicals there are different type of chemicals. So if you go to respiratory protection, there are different types of respiratory protection means. Okay, so for every respiratory protection, I mean, for different type of chemical, we are having ratings. Okay, or it is given I mean, like ABCDFGH only, they will give several ratings for several respiratory protection. That type of protection we will have to choose. Okay, so there is cartridge gas mask, normally we use for chemical exposure respiratory prevention. So that cartridge mask we have to use, and that too is mentioned in your MSDS, which mask you have to use and all. Okay, so go through all the risk phrases, whatever is mentioned, and what protocols has to be followed to prevent the exposure, chemical exposure, and what if exposed, what you have to do. One thing, if any chemical fall in your eyes or in your skin, you have to rinse it off, then go for the further treatment. Okay, and medical attention is certainly required depending on the criticality of the particular chemical, or the what is it, the nature of the particular chemical. Seek immediate medical attention. And Next is, okay, so exposures. How do we determine exposures? Okay, so before determining exposures, we need to know about few key concepts, which is TWA. TWA is time weighted average. So this is the limit, okay, which should not be exceeded. This is the exposure limit which should not be exceeded, okay. Sorry, okay, we should not be exceeded, okay, right, okay, exceed. So this TWA is calculated for 8-hour shift, 8-hour shift, 5 days a week, so 4 hours a week, okay. So even though a person is working at this limit, he will not have any adverse effects, okay. So that is TWA. TLV is threshold limit value. This is the value, exposure value, which should not be exceeded. So when we are discussing about TWA, we will not call it a simple TWA, we call it TLV TWA, okay. So the limits of this TWA and all always refer to ACGH, okay. If you are not getting values of ACGH, then you can even refer to NIOSH, or you can just go through some CDC or all, and you will get these values of TWA, okay. If it is Factories Act, then go to Schedule 2 of the Factories Act 1948, okay. Okay, there you will get your TLV, TWA values. So similarly, we have STL, which is exposure limit. This is a value similar to TWA, but this value is only for 15 minutes exposure, okay. This is only for 15 minutes. So if any person is exposed to a particular chemical, okay, for 15 minutes in a day, then the rest of the day he should not be exposed to that particular chemical again, okay. So that is what STL represents, okay. So all the values which are there will be given as TLV, STL. Then we have CL, which is ceiling limit, okay. This is the limit which should never be reached, okay. And then we have IDLH, which is immediately dangerous to life and health, okay. So these are the values that we have to take care. Even IDLH values should not be there, but there is a scope of rescue, even if the scope of rescue and recovery if the person is exposed to this IDLH values, but we need to have immediate medical response should be given, okay. So how do we determine this TWA value for mixed chemicals. Okay, how do we determine the TWA of mixed chemicals? Textbook. Yeah. Okay, see, if there is a single chemical, okay, or multiple chemicals, single chemical or multiple chemicals, and a person is exposed to different times, okay, if a person is exposed to different time zones, different times, then how do we calculate that particular TWA? Then we use the formula TWA equal to T1C1 plus T2C2 plus T3C3 plus so on divided by T1 plus T2 plus so on plus Tn. Normally this is our total working hours in a shift, that means 8 hours, right? And here we might have exposed to 1 hour you might have exposed to one chemical with a particular concentration, second hour you might have exposed to another chemical with different concentrations. So similarly different concentrations will add up. So this is one formula that we will use, okay. And if we want to see whether how much we have overshot from the recommended exposure limit, then we will use the formula of percentage RL, that is equal to 100 of TWA1, this is TWA, right? So of one chemical divided by recommended exposure limit of that particular chemical plus TWA2 divided by recommended exposure limit 2 plus so on. Okay, so how many chemicals are there? That many limits we will get. Okay, right. So this is one formula that we will use, and this is for exposure limit for gases, but if it is liquids, then we are having we will use the formula TLV effective equal to 1 divided by F1 by TLV1 plus F2 by TLV2 plus so on. Okay, this F1 F2 represents the percentage of that particular component in the mixture. Okay, these were mixed liquids. So sometimes what happens in a one particular mixture, we might have X component as 20%, Y component as 30% and Z component as 50%. So that is the fraction it is denoting. So 20% is 0.02, 0.2, 30% is 0.3, 50% is 0.5. So we will just substitute those values and we can try to figure it out. So this way we will be finding TWA for mixture of chemicals. Okay, the TWA of that particular chemical is already given in the MSDS. So by using those values we will try to calculate this particular exposure limits. Okay, so apart from this we are having other formulas we use. One is for quartz. Okay, TLP quartz, these values are already there. I mean, this formula is already there in our factory act schedule 2. At the end of it, 10 milligram per meter cube divided by percentage of RQ plus 2. Okay, this is the value, whereas percentage of RQ is the respirable quartz dust. Okay, mass in percentage of respirable quartz dust. Okay, similarly we have mixture of quartz cristobalite and trisome or tridymite. You can find that formula even in our factory act. Okay, by using this formulas, very simple formulas, if you just do couple of sums, you will be understanding, okay, how to calculate TW of mixture and all. So if a person is exposed to safety, okay, as a control measure, one thing we will, if it is on the skin or eyes, we will just rinse it. If it has inhaled too much or drank too much directly, we will seek medical advice, nothing else. But remember one thing, when you are going for medical attention, always remember to keep MSDS in hand, because in MSDS even the treatment how it should be given is already clearly mentioned. Okay, so that becomes easy for doctor to treat him. Okay, and make sure to know what chemical he has inhaled or he has taken in. Okay, so that makes things easier. Okay, this is about chemical safety. Even laboratory safety, chemical safety is all about not having exposure of chemicals on the human body. Okay, take care of that.